Start.
I am Dr. Asutosh Mohapatra. I am a gastroenterologist in Apollo Hospital, Bhubaneswar. Today's theme is GERD, that is otherwise known as GERD, Gastroesophageal Reflux Disease. It's commonly believed that this GERD is a very common disease, common gastrointestinal disease, GI disease, and symptoms of GERD varies. And to the layman, to the people, to the common people, it is acidity, and this acidity is usually due to the reflux of acid content of stomach into the esophagus, or that is called food pipe. And when this acid comes into the esophagus, there occurs burning sensation in the chest or in the retrosternum. There the patient gets a bitter taste in the mouth, or there is a burning sensation in the chest. This is called gastroesophageal reflux disease, where the contents of the food particle mixed with acid comes into the esophagus. So common symptoms of reflux disease is, one is chest, sometimes there is a chest pain, and there is acidity and burning sensation of the chest. Second thing is, when should a patient or when should a person consult a doctor or a gastroenterologist? When this acidity or this burning sensation becomes worse and it hampers your day-to-day activity, you should consult a doctor. Usual medications like antacids sometimes work for a short period, but there are a group of medicines called proton pump inhibitor, that is omeprazole, pantoprazole, lansoprazole, esomeprazole, which are very much effective. And these GERD symptoms are usually chronic. It persists in persons for years together. So this PPI, proton pump inhibitor, that is esomeprazole, that which I told earlier, it is usually a safe medicine. Patients can take it for a very long period, even for years together. Patient used to take, and there is usually symptom relief occurs if you take this medicine for a prolonged period. Even for months together you can take easily, and usually there is no complication associated with these medicines except some vitamin B12 deficiency, and in some animal model there may be some carcinoid tumor, but it is not yet proven. And reduction of symptoms like GERD symptoms can be reduced if you have a lifestyle modifications. Patients with obesity, they must reduce their weight. They should have a morning walk, and proper meal is most important thing. You must divide your meals. Small meals you should take every 3 to 4 hours, and before going to bed you should take a dinner at least 2 to 3 hours before going to bed. That will, and one who is a smoker, he must stop smoking, and they should reduce their alcohol consumption. And these are the advice one should give to the patients. And there are some warning signs of GERD. If this acidity gets aggravated, and if a patient more than 40 years of age, if this acidity gets aggravated and the patient has symptoms of anemia, weight loss, and blood stool, they should consult immediately to the doctor, and doctor may order a endoscopy, upper GI endoscopy, to evaluate your food pipe, that is esophagus and stomach, to look for any ulcer is there, or there is any other malignancy like cancer of the stomach is there, because this acidity and reflux symptoms sometimes get confused with the even ulcer symptoms and cancer symptoms. They are very insidious in nature. The patient with a stomach cancer may present with weight loss and reflux symptoms. So patient with anemia, weight loss, difficulty in swallowing, they must consult the doctor at the earliest.